My name is Carrie Allen, and I am a consultant pharmacist. I'm here to talk to you today about the 5 elements of a great med pass. If you pass meds, you know that there's a lot more than 5, but these are the 5 major basic areas that you should be concerned with when someone's watching you do a med pass, but also just on a day-to-day basis. Aspect number 4, we're getting to the end here of our 5 aspects, infection control. We've hit it a little bit. You want to make sure that we're storing all of our meds away from contaminants. So make sure there's no bugs. I can't tell you. I've opened up carts and there's been roaches. It's just disgusting. Make sure those insulins are in date and they're not growing bacteria. And remember that sterility versus stability. Make sure that we're hand washing appropriately and often. We're using sanitizer between residents, and we're always washing after touching mucous membranes or touching residents. Don't come to work when you're sick to spread disease. Don't touch your hands and face and nose and mouth and then go around and touch people's medications and hand that to them. That is inappropriate and gross. We don't want to be doing that. You're going to be spreading infection, so wash your hands. If you have to touch your hair, my bangs are growing out right now. I'm always touching my hair. What you need to do is wash your hands before you go back and help residents with their meds. Rings can tear gloves. Necklaces can catch on resident clothing. And I'm going to say this, and I mean it, most long-term care facilities do not have a policy about fake nails. I think they're pretty. I like them. But you know what? We shouldn't have them. That is my position on that. When we make medications in the hood and we're injecting a bunch of things and we're wearing gloves and we're getting them ready for residents, we are not allowed to have fake nails of any kind because they breed fungus. Anybody can tell you that. Fungus has spores, so you're not going to have to rip that nail off and rub it on something to spread a fungus to someone. So what you need to do is get a policy together that sort of excludes those fake nails. I know the fake nail people are going to come after me on that because we all love them and they're super pretty and they're expensive and you want to maintain them, but it does breed fungus. No pill touching, no apparatus or applicator touching. If you're going to spoon some of your creams out, you want to make sure that you're not just, squirting them in your hand or touching the top of it at all. See how I'm touching this? That's gross. You can't be doing that. So it's important to pay attention to what you're doing, basically. Know your bugs. Know that C. difficile doesn't get killed by sanitizer and you have to wash your hands. Clean your pill counters. Sometimes, we're scraping penicillin across a pill counter for some reason because we're counting it at the end of shift because some facilities do that. Well, if someone's allergic to penicillin, you can't have that penicillin dust on there when you're counting their hydrocodone later. So you need to make sure you're cleaning those in between. Clean your med crushers. Make sure that we're not crushing meds and getting the powder all over everything. When you use a med crusher, if you can, use these little pouches. I realize that they're expensive, but they're thick plastic, and they will help us to not contaminate the inside apparatus here with pill dust and make it gross and contaminated with things that can hurt other residents. Some people will use the pill crusher, stick a pill in one cup, stick the other paper cup on top, and crush that way. That's not altogether wrong, except for you have to be super careful. If you've got something that doesn't crush well, you're going to end up tearing this. You're going to get little paper bits in with what the resident's going to swallow, and that's not good either.